The theme of World Health Day this year is diabetes. Diabetes is a major health problem globally and in the Eastern Mediterranean region. Out of the 422 million people living with diabetes across the world, 43 million are in this region. Our region has the highest rates of diabetes in the world. From an estimated prevalence of 6% in 1980, the prevalence of diabetes had risen to 14% in 2014, and this number is still rising. Recent studies show that the prevalence of diabetes in adults has reached more than 20% in some countries. And most of the increase in this condition reflects rising rates of type 2 diabetes, one of two forms of diabetes. And type 2 accounts for 90% of diabetes cases worldwide. It occurs when the pancreas does not produce enough insulin, or when the body is unable to use the insulin it produces. Type 2 diabetes is largely the result of excess body weight, physical inactivity, and unhealthy dietary practices. It is important to remember that diabetes increases the risk of heart disease and stroke, and is also a leading cause of blindness, lower limb amputation, and kidney failure. Therefore, it is critical to prevent diabetes and its complications. Governments, healthcare providers, civil society, and individuals have a shared responsibility in preventing and in managing diabetes. Governments are responsible for raising public awareness about the threat of diabetes, for creating environments that enable people to follow healthy lifestyles, and for implementing measures that reduce the exposure of populations to risk factors that can lead to diabetes. They are also responsible for ensuring access to acceptable standards of healthcare for all people with diabetes. Individuals, at the same time, need to take responsibility for their own health through simple lifestyle measures, because such measures have a tremendous impact on preventing or delaying the onset of diabetes. These measures include engaging in regular physical activity, maintaining a healthy weight, and eating healthy food. I would like to stress the point that a person with diabetes can live a healthy and productive life if the condition is diagnosed early and is managed effectively by healthcare providers and by the person himself. Early detection and appropriate management, including medication, lifestyle measures, and regular follow-up, can control diabetes and prevent the development of complications. This year, World Health Day, the 7th of April, is an opportunity for all of us to have an impact on diabetes. Let us prevent millions of people in our region from developing diabetes, and let's help those who have it to live healthy and active lives. So let's break the bad habits, eat healthy, be active, and beat diabetes.